Science rules.
Hello everyone, and how are you all doing today? I hope that you're all doing very, very, very well. So today, I'm going to take you on a new little trip, if you will, down to talk about FluxxLabs and their CBDA and CBD gummies, tablets, products, etc. So without further ado, we need to talk about this company and their letter from the FDA. That's right. So then let's roll that intro and get right into it. This here is the FluxxLab website. As you see, they claim to have Delta 8 reinvented. Delta 8 THC reinvented, breathable nano powder, very rapid onset with none of the negative side effects of vape. They also sell several CBD and CBDA gummies, oils, and the likes. Their products are almost $100 each, but you do get a month's supply, so I guess whatever. As most of these companies do, they claim that the results outperform any other CBD that anyone has ever tried. THC free brings peace of mind. Enjoy peace of mind while you relax and experience all of the remarkable benefits of our full, rich, and very complete hemp extracts. Each product is uniquely balanced with broad spectrum cannabinoids and topped off with our own very remarkable beta caryophyllene, the most potent and richest cannabinoid of all. THC free is a wonderful CBD experience. See product descriptions for details. Yeah, so you get about 30 tablets in each bottle. Highest concentration. We offer our customers highly concentrated CBD because we believe that you should get the most out of the product you purchase. The very best CBD you can use. We carefully adjust our concentration levels to be just right for your individual situation. You don't need to consume big quantities. The right amount can make a huge difference to your life quality and your pocket. Highest bioavailability. Bioavailability is how our body benefits from medications, but also food and anything else that you ingest. Our researchers are highly knowledgeable in the way the human body functions. With this in mind, we have formulated our products so that they are uniquely bioavailable. Keeping a measurable level of cannabinoids in your body is one of the best ways to manage your body's balance and resilience. Highest potency. CBDA is many times more potent than plain CBD. High potency, however, does not simply mean that something works better. It also means that something works better in lower doses. Lower doses of CBD can be more efficient, more potent, and easier to consume while still producing exceptional results. If you have been looking for a CBD that meets the claims of being the strongest, you have found it. FluxxLab is the strongest CBD on the planet. A strong dose of passion with a combination of old world craft and new world science. Enjoy a better, healthier life. People who take their daily dose of CBDs usually find that they enjoy a healthier, happier life. Many people believe that the body's response to cannabinoids often seem miraculous. However, the most persuasive reason to use CBD is for general health. The body's endocannabinoid system is constantly in need and does not get properly stimulated with normal diet and exercise. Because CBDA is the quote-unquote raw cannabinoid precursor, it is perfect choice for daily stimulation and overall health. Compared to all other cannabinoids, CBDA is the best all-around first choice. FluxxLab, trademark, offers CBDA in various forms to help you who want to lead a better and healthier life. Huh? What is CBDA? CBDA is the quote-unquote natural life precursor to CBD, and it begins life in the live plant, but almost always degrades to CBD during harvesting and processing. Preserving CBDA and preventing it from converting to plain CBD is an art, a craft, and a science. Refining and preserving the very best cannabinoids is what we do at FluxxLab. Nobody does it better. Click here to learn more. We are the world's experts at bringing you pure, refined CBDA. Satisfaction always guaranteed. We stand behind every product. If you aren't 100% satisfied with your product, return for a full refund. Reviews. Best CBDA I've ever tried and the only one I could feel working. Tom. Incredible product. No other CBD comes close. Sarah. So as you can see, they're in Montrose, Colorado, and that is where the main headquarters is. As someone who's a stoner, you see, my issue is not with the fact that they are selling CBD or CBDA. No. You see, there's a particular product that we need to talk about. CBD tincture products by FluxxLab, trademark. The strongest CBD tincture on the planet, FluxxLab, trademark. CBD tinctures are more powerful and potent than any other tinctures in the market. Nothing else comes close. Completely natural and many times more effective than standard CBD tinctures. Your complete satisfaction is always guaranteed. At FluxxLab, trademark. We have developed a cryo-extraction process that isolates the cannabinoids. They claim that their ultra-premium CBD tinctures are the cleanest and strongest that anyone could ever experience, or they will give you your money back. They also claim it's 100% pure CBD oil. As advertised, best CBD I've ever tried. You can feel it. Tyra M., Santa Clarita, California. And once again, the products seem to range anywhere from $50 to $100 or even higher. As you can see, some of them get close to $200 here. And my first thought, as someone that goes to dispensaries often, is holy crap, that is really expensive. But the FDA had another thought, because you see, this isn't what the website looked like a week ago. According to consumerlab.com, August 4th of 2022, the FDA sent a warning letter to FluxxLab LLC following a review of the company's website and social media, which found statements about the company's COVID-19 immune support tincture and CBDA plus CBD oil tincture products to be drug claims because they are intended to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. I also want to bring up here that on May 4th of 2022, the FDA issued warning letters to 5 companies for selling CBD and other products labeled as containing Delta-8 tetrahydrocannabinoid, Delta-8 THC. Some of the products, including capsules, tinctures, gummies, and topical creams, use CBD in the product name, but also list Delta-8 THC on the label. This company does that as well. This here is the FluxxLab website. As you see, they claim to have Delta-8 reinvented. Both CBD and THC are compounds derived from hemp, but CBD is not believed to have psychoactive properties. THC is known to have psychoactive and intoxicating effects.
How you feeling, man? I'm pretty lucky.
And the FDA has warned consumers is associated with certain health risks and advertised effects such as confusion, dizziness, vomiting, and hallucinations. According to the FDA's news release about the warning, CBD and Delta-8 THC are unapproved food additives for use in any human or animal food product, as the FDA is not aware of any basis to conclude that the substances are generally recognized as safe, GRAS, or otherwise exempt from food additive requirements. And it has not approved Delta-8 THC as an ingredient in any drugs. FluxxLab does have products that claim that they contain Delta-8 THC as well. Delta 8 reinvented. However, that was not included in this FDA letter. I do have the FDA letter here. Let's go through it now. Here is the warning letter from the U.S. Food and Drug Administration, FDA. As you see, it is dated for August 4th, 2022. I really do hate when these companies make these false medical claims, and so that's why I wanted to talk about this. I wanted to show that it's not just MLM companies and scams that do that. This company is apparently like a real company that sells products, okay? They say here, this is to advise you that the United States Food and Drug Administration, FDA, and the Federal Trade Commission, FTC, reviewed your website at the internet address fluxxlab.com on July 12, 2022 and August 1st, 2022, respectively. The FDA has observed that your website offers the COVID-19 immune support tincture and the CBDA plus CBD oil tincture products for sale in the United States, and that these products are intended to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. Based on our review, these products are unapproved new drugs sold in violation of Section 505A of the Federal Food, Drug, and Cosmetics Act, FD&C Act, 21 U.S.C. 355A. Furthermore, these products are misbranded drugs under Section 502 of the FD&C Act, 21 U.S.C. 352. The introduction or delivery for introduction of these products into interstate commerce is prohibited under Sections 301A and D of the FD&C Act, 21 U.S.C. 331A and D. There is currently a global outbreak of respiratory disease caused by a novel coronavirus that has been named Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The disease caused by the virus has been named Coronavirus Disease 2019 or COVID-19. On January 31st, 2020, the Department of Health and Human Services, HHS, issued a declaration of a public health emergency related to COVID-19 and mobilized the operating divisions of HHS. In addition, on March 13th of 2020, there was a presidential declaration of a national emergency in response to COVID-19. Therefore, the FDA is taking urgent measures to protect consumers from certain products that, without approval or authorization by the FDA, claim to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. As described below, you sell products that are intended to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. We request that you take immediate action to cease the sale of any unapproved and unauthorized products for the mitigation, prevention, treatment, diagnosis, or cure of COVID-19. Some examples of the claims on your website that establish the intended use of your products and misleadingly represent them as safe and/or effective for the treatment or prevention of COVID-19 include CBD plus CBDA immune support special formulation. In a recent study, CBDA was examined to determine how cannabinoids interact with COVID-19. Researchers discovered that cannabidiolic acid, also known as CBDA, binds to the spike protein of SARS-CoV-2. As the compounds bind to the spike protein, they prevent the virus from infecting cells and causing infection, opening up new avenues for the prevention and treatment of the disease. And then they link where it was on the website. Special immune support formulation. See COVID-19 research. Researchers have very recently discovered that CBDA and CBGA bind to the spike protein of SARS-CoV-2, the virus that causes COVID-19. As the compounds bind to the spike protein, they can prevent the virus from infecting cells and causing infection. The product name, COVID-19 Immune Support, and then they link the web page where the product is listed. They go on to say, you should take immediate action to address the violations cited in this letter. This letter is not meant to be an all-inclusive list of violations that exist in connection with your products or operations. Delta 8 reinvented. It is your responsibility to ensure that the products you sell are in compliance with the FD&C Act and FDA's implementing regulations. We advise you to review your websites, product labels, and other labeling and promotional materials to ensure that you are not misleadingly representing your products as safe and effective for a COVID-19 related use for which they have not been approved by FDA, and that you do not make claims that misbrand the products in violation of the FD&C Act. They then say that the company has 48 hours to send an email to the COVID-19 task force at the FDA that describe the specific steps that they've taken to address the violations and how they are going to prevent the recurrence of any violations, as well as copies of related documentation in future. They say failure to adequately correct any violations may result in legal action, including without limitation, seizure, and injunction. They go on to give them further information of the laws and the rules. If anyone out there does see people that are doing false medical claims about COVID-19, please direct all inquiries to the FDA at covid-19-task-force-cder@fda.hhs.gov. They then give the cease and desist demand from the FTC, and of course they sign it, as in both the FDA and FTC sign this letter to FluxxLabs. And again, that was on August 4th. Now, there is kind of a happy ending to this story because it does appear that they have taken those claims off of their website. I clicked on both of the links. Here is the one for the immune support special formulation that they listed, and as you can see, no results are found. And here it is for the other product, which involved their CBD oil. And as you see, once again, no results are found. So FluxxLab has removed that from their website. The only issue on this company's website now, as I pointed out, is that they are selling products with Delta 8 THC. Hemp plants secrete many different cannabinoids. Among them is a special one named Delta 8 THC, also called D8, or what the hell is that supposed to be? In hemp flower, Delta 8 THC occurs at very low concentrations, less than 1%, but modern extraction techniques have discovered methods to isolate this cannabinoid. It is similar to nature to Delta 9 THC, the major intoxicating component in marijuana that's responsible for getting you high.
How you feeling, man? I'm pretty lucky. 2 blades.
But without the overpowering effects. I don't get the fun in it, but anyway. Think of Delta 8 as the more mild version of Delta 9 THC. The benefits of Delta 8 THC include feeling relaxed and lucid, and unlike Delta 9, users who consume Delta 8 experience a sense of focus and clarity without any paranoia. Then they go on to make an illegal medical claim when they state D8 also possesses neuroprotective properties in it that help relieve nausea, anxiety, and pain.
Lucky.
And then, as you can see, they have several Delta 8 products, and right now, Delta 8 is not supposed to be getting sold. So I'm a little bit confused as to why they think they can sell that, especially after getting these letters. Let's talk about the Delta 8 issue for real. Technically speaking, Delta 8 THC is a synthetically derived compound because it's created using unnatural processes. You're not going to find the hemp plant mixing up hydrochloric acid or PTSA and refluxing it for 20 plus hours to convert the CBD into Delta 8. This is something that only happens because of human intervention. CBD does not naturally convert into Delta 8 THC. Only Delta 9 THC will convert to Delta 8 THC, quote unquote, naturally when exposed to the right conditions. Exposure to oxygen, heat, and UV radiation will cause Delta 9 to break down into either Delta 8 THC, the more stable form, or CBN, cannabinol. This process takes a long time, it's very ineffective, and it only produces trace amounts of Delta 8 THC. Some companies are quote-unquote aging marijuana flower under conditions that facilitate this conversion, which allows them to extract and concentrate the Delta 8 THC quote-unquote naturally. However, the yields are very low, and these products would be considered illegal in any country or state that doesn't allow the sale of marijuana recreationally or with specific licenses. And that's why a company like FluxxLabs needs to be careful when selling anything with Delta 8 THC in it. Here is a list of all of the states where Delta 8 THC is banned.
Alaska, Arizona, Arkansas, Delaware, Idaho, Iowa, Mississippi, Montana, Nebraska, Rhode Island, Utah, Vermont.
It is legal in Canada in all forms. However, it's not as popular here in Canada as it is in the US, and it's fairly difficult to find, which is why people would maybe think about ordering it from a place like FluxxLabs. Delta 8 is actually illegal in the United Kingdom. In Australia, Delta 8 is illegal unless specific medical approval is granted. So then that begs the question of how is this company that we're discussing today actually making the Delta 8 THC, and how is it then distributing it, and is it distributing it to the countries in which it is illegal or states in which it is illegal? FluxxLab is not the only company that has gotten a warning letter stating that their products, their CBDA and CBD oil products, could help cure COVID. So where are people getting this information from? They cite a study. What is this study? What's going on? Let's take a moment and look into all that now. So back in January of 2020, a study from Oregon State University made waves when it demonstrated 3 cannabis-derived compounds, cannabidiolic acid, CBGA, cannabidiolic acid, CBDA, and tetrahydrocannabinolic acid, THCA, definitely butchered all of those, I am so sorry, have the potential to prevent the coronavirus from entering human cells. But some researchers are urging the public to take caution amid these findings. The research still has a long way to go to prove what, if any, effects can play out in humans. And this is why this has not been okay to say when you run a company, and why the FDA and the FTC will get you in trouble. Not enough research has actually gone into this. Dr. Ethan Russo, MD, a board-certified neurologist and founder of CREDO Science, says, "You go into these things hopeful that they're going to pan out to match the hype. A biopharma holding company that exists to solve problems of the human-animal endocannabinoid systems, including developing optimized formulations from the cannabis plant for better living," according to the company's website. But something everyone has to realize straight out of the chute is there's this tremendous gulf between lab results and what may be achieved clinically. The OSU study has shown exciting preliminary results for Richard Van Bremen, a researcher with Oregon State's Global Hemp Innovation Center, College of Pharmacy, and Linus Pauling Institute. This could be a once-in-a-lifetime event, he says. Van Bremen led the OSU study, which was published in the peer-reviewed Journal of Natural Products. It was a two-step process we used: initial discovery with analytical chemistry, and then a functional cell-based test that showed activity. He says, during the initial discovery phase, Van Bremen and his team studied a range of botanical products' effects against a spike protein found in SARS-CoV-2. Full-spectrum hemp oil and more refined hemp oil products were part of that lineup, he says. Using a mass spectrometry-based screening technique invented in Van Bremen's laboratory, the researchers found CBDA, CBGA, and THCA all bound to the SARS-CoV-2 spike protein, blocking a critical step in the process the virus uses to infect people. And that was according to the OSU press release. And this is what the companies are quoting on their websites when they claim that their products can help cure viruses, especially COVID-19. The researchers then tested an equal amount of each cannabinoid found in the hemp oils on the virus. Notably, Van Bremen says CBD and CBG did not bind to the spike protein like their acidic forms did. Then they moved that research functional phase to collaborate with other researchers from Oregon Health and Science University, testing CBGA, CBDA, and THCA on the live virus using human cells. The functional test showed the compounds had antiviral activity, Van Bremen says. Importantly, the researchers found there are at least 2 different places on the spike protein of the virus to which these compounds bind, meaning that while one of the compounds could be effective against shortening or even completely blocking infection, combining the compounds could prove to be even more effective. Again, could prove, has not yet proven to be, but could in future. The OSU team plans to continue looking into the potential of combination therapy. They're also working to set up clinical trials to test their findings on human subjects. So since they have not tested findings on human subjects, other companies, they can't be like running their own human subject tests and trials with their products. Once the study is set up, Van Bremen anticipates results could come before the year is over. And once again, this information really just became public in January of 2022. It's unknown whether any current products on the market contain enough CBDA, CBGA, or THCA to yield potential benefits, Van Bremen says. But ultimately, he envisions these results could be replicated in an oral dietary supplement that is used in combination with vaccines. So it's almost like FluxxLabs read this article and then thought, we'll use this information to sell our crap. Based on what's in the literature, we predict these concentrations are achievable therapeutically, Van Bremen says. But Russo questions whether the concentration needed for these compounds to be effective in humans, as cited in Van Bremen's research, is realistic. A concentration of any compound beyond 10 micromolars is hard to achieve in a living organism. And the issue is that the OSU cites even higher concentrations needed for the CBDA, CBGA, and THCA to be effective against the virus, as in the COVID-19 virus. He heartily disagrees that it is achievable by oral administration, which he believes would be the only reasonable way to do this type of treatment. And he also urges caution about the results. He says clinical trials often yield different results than those demonstrated in a lab. And acidic versions of cannabinoids are notoriously unstable. When exposed to heat or light, they tend to break down into their quote-unquote respective neutral cannabinoids. He does, though, say that this research could be the basis for something. But again, I just want to point out that this is still being researched. It has not yet been tested on humans. The results show promise against SARS-CoV-2 and potentially against other viruses as well. They have done other studies that have shown this, but again, all of these are in early stages. They also say to make sure that this does not become a replacement for masks and vaccines, which of course is always a worry whenever something like this pops up. This is a case of a company that has taken information from the Oregon State University study here and other studies, and then acted as if these were actual results that came in, when really we're in early stages of studying this, and nobody can say for sure that anything can prevent or treat COVID, as we also don't know what causes it, and we would have to look more into that as well. It is promising. We can hope in future that this research will go somewhere and that it will help us fight off all viruses, as that could happen in future. But as of right now, there is not enough evidence to prove that, and none of this information has been approved by the FDA or the FTC so that companies could claim this when they sell their products. I also just want to show you that there still hasn't even been that much research into what CBD can do for us. It may relieve anxiety and help one sleep, but again, that has not been studied enough yet. And this is why companies that sell CBD products cannot make these illegal medical claims. The most widely researched use for CBD is for epilepsy. And the FDA has approved a CBD-based drug, Epidiolex, in 2018 to treat rare forms of the disease. But again, we're still in early stages of the research and of the FDA and FTC saying, yes, we can now use this information in CBD to make medical claims. So companies can still not be making these medical claims or claim that CBD oil can relieve anxiety, help you sleep, or the likes. And it's a very big issue out here. It messes with the research of CBD. It messes with the legalities of it, and companies really have to stop doing this. So guys, that was my little rant about CBD oil companies and why they cannot make illegal medical claims, and how several of them have been caught doing so, most recently the company Fluxxlab LLC. I did feel like that was important to talk about this since they just got their letter last month, and although they have scrubbed what they should have off the website, there might be other problems in terms of Delta 8. No. And the FTC and the FDA should look into them and whether or not they are selling these products to places where Delta 8 is not even legal. Maybe that's just me. No. I do like to talk about companies and the things that they do wrong on this channel. I also like to talk about cults, and then every once in a while we just have some fun and talk about random crap, and I love to do some comedy. So if you're interested in a little bit of everything apparently, please do subscribe to this channel, give this video a like, and think about joining our fabulous, amazing members. All of the beautiful people do. No. And you don't want to be ugly like someone that works at FluxxLabs who is making illegal medical claims about COVID, of all things. Again, thank you so much for tuning into this video, and I will see you all very, very soon with another one. Take care. Mwah. Bye. Be careful of these companies with their damn illegal medical claims, dude. Delta 8 reinvented.
How you feeling, man? I'm pretty lucky.
2 blades.
No.
Science rules.